Welcome to Your Transformations, and we're honored to be sitting today with Dr. Douglas Brooks, the founding physician of Men's Health of Parkersburg. Dr. Brooks has been providing proactive and compassionate care to men for a number of years and has made a tremendous difference in many people's lives. Welcome, Dr. Brooks.
Thank you very much for having me, Richard. I appreciate that.
Yes, sir. Let's start with first, what inspired you, motivated you to start this type of practice, and kind of explain a little bit about it too, versus a conventional network office?
Yeah, so I've done corporate medicine on several occasions in my life. I did it in Florida. That was my first go, and then in North Carolina was my second go, and then most recently even here in Parkersburg, West Virginia. And I just discovered that I couldn't offer the best, what I felt to be the best care to my patients in a corporate model, where you're only allotted so much time to be able to spend with your patients. In addition, I've often said that children have pediatricians to go see and women have obstetricians, but men never really have had their own kind of physician that they feel comfortable establishing a relationship with. So with all that, I decided to open what's called a concierge practice, or another term for it is direct primary care, where you kind of take out all the middlemen and it's just you and the patient. And so my model here at Men's Health of Parkersburg is for men only. So we only have men in the practice. We do not see women or children any longer. And also, I can consider there to be three tiers to concierge, or what sets concierge medicine apart from corporate medicine, which is we give hour-long visit slots to all patients, because I truly believe that you just can't cover enough in 5, 10, 15 minutes. Those are what corporate medicine slots are usually put at, and so you just can't cover enough from a history and a physical and a planning stage in those 15 minutes. And in fact, there are studies that show there's a direct correlation between the amount of time you spend with your doctor and your survival rate, the longer you live. So 15 minutes versus an hour, you're going to live longer if your doctor offers you more time per visit. The studies have proven that. So here at Men's Health, we give hour-long visits to every patient. The second thing that makes concierge different is that we offer same-day availability. I know that most people in corporate practices have discovered that it may take days to weeks to be able to get into their physician, because those practices are so full that there's no schedule availability. With a concierge practice, we keep our numbers lower so that we always have same-day availability available to patients to come in when they need to come in. I think that's important for good health, preventative health, good patient satisfaction, all that. So that's the second tier. And then the third thing that I think separates concierge in my practice from other practices is that patients get my cell phone for evenings and weekends. They can text me if they're out of town. Let's say they're on vacation and they get sick or hurt. Then they can text me or call me on an evening or a weekend, and I will find the pharmacy where they are, and we will be able to help them out in that regard. So those to me are the three biggest things, and those are what we think sets us apart, is longer visits, same-day availability, and then what we call direct access to the physician, which means that they have my cell phone to be able to get in contact with me.
Okay, thank you. I know it will be important to me to feel like I'm actually being seen and heard and understood, and I have more time to understand the doctor. But from your own anecdotal background, what are some examples of that goes along with your stats you do, so where being able to take that time back and forth in the conversation actually had real life positive impact on patients, viewers.
Yeah, so again, to be able to accomplish an entire history and a nice head-to-toe physical and in planning stages of, what labs you're going to order, all the health maintenance issues that you want to review, again, simply cannot be accomplished in 5 to 15 minutes. So you have to have longer visits. And I kind of follow, I follow there are some literature and guidelines on what men of all age groups need to have done. And so every visit with a man, no matter what age group, because we take patients probably our starting age is around 15 to 16, and then we do carry it on all the way to complete geriatric populations. So at every age there are different issues and different recommendations on health maintenance and that kind of thing. As you and I were speaking earlier, the three can be early killers of men that I really look out for are prostate cancer, colon cancer, and early heart attacks. Prostate cancer, the current guidelines are to check a PSA level in men, a Caucasian men at age 50 and African American men at age 45. However, I just had my most recent patient diagnosed with prostate cancer at age 43, and he was Caucasian. So now I start all my prostate cancer screenings with PSAs at age 40, which again is 10 years sooner than some of the literature recommendations. But again, if I waited to check his at 50, we would have missed 7 years, and he likely wouldn't have been alive. The second one is colon cancer, and they have recently dropped the recommendation for colon cancer screening from age 50 to 45. And we're not sure why colon cancers and prostate cancers are happening earlier in life, but it can be due probably to diets and environment chemicals and other things. So we are seeing colon cancer in men as early as 45. So now colonoscopy is recommended, or Cologuard, which Cologuard is the 3-year home test, whereas colonoscopy is an outpatient procedure that's, if everything's normal, is good for 10 years screening. And then the final thing that I've really looked into is early heart attacks, or what we call premature coronary artery disease in men. I really got interested in that because my own family, both my mother and father, were diagnosed with early heart disease in their lifetime. And so that became an interest of mine. And what defines early heart disease is men that get heart disease in their 50s or women that get it in their 60s. That is then considered premature, which usually has a genetic component to it, which means it's probably passed down to, children, or it could be brothers, uncles, and other places. So there now has become an inexpensive test called the coronary calcium. It's basically a CAT scan that does not have dye involved. It probably takes 5 to 15 minutes, to where they try to measure the coronary or the calcium plaque buildup in your coronary arteries to see if you do have clogged arteries. It's a simpler and less expensive screening test than, say, a stress test where they lay you on a treadmill and inject dye, or even like a full catheterization, where they have to go through an arm or a leg to shoot dye and take pictures. I offer that to all my men because some people because here in town it only costs $99 at WV Medicine. They're offered a cash price at $99. So I offer it to all my men, regardless of family history, just because a lot of people want to know. But again, unless there's a family history of early heart disease, most of those that you order on people without that history are going to probably be normal, and it may not be necessary. But in anyone that has a family history of early heart disease, for my patients, I do recommend that they have the coronary calcium. And I said that we really looked at their lipid panel to make sure we keep their bad cholesterol, their LDL at very low levels, even under 100, closer to 50 to 70.
Let's talk about some of these a little more in depth. If you had a patient who was reticent about undergoing the colonoscopy, what would your message be to him via the conversation?
Well, in the literature, they actually do say if someone is absolutely 100% against colonoscopy, Cologuard is a very good option. Cologuard in the literature is 93% accurate. That means that they're going to miss 7%, of cases. Sometimes you'll get either a false positive, meaning that the Cologuard will come back positive, even though you don't have cancer. And then you have to have a colonoscopy to prove that you don't have cancer. But sometimes the more worrisome is when they come back negative, and then that's a false negative when you have a negative Cologuard test, but you do have colon cancer. And so, like I said, that happens on average 7% of the time. Theoretically, colonoscopy is 100% accurate in the hands of a good gastroenterologist or surgeon or whoever's doing your colonoscopy, and if you have a good bowel prep. So in that case, they recommend colonoscopy every 10 years because polyps, which are found on colonoscopies, generally take about 10 years to develop into colon cancer. And so that's why they say that you should have a colonoscopy excuse me, every 10 years. And then if there are polyps, you remove the polyps, and then if there are polyps, they most of the time they do shorten the range from 3 to 5 years instead of 10 years for colonoscopies. But if you're completely clean, then they recommend 10 years. Whereas Cologuard looks more for blood and cancer DNA in the stool, and then that's a recommended test every 3 years. So people are reticent, like you said, to get colonoscopies, but what I tell them is first of all, I've had 3 in my lifetime, and it's really not a bad procedure. The day before you do a bowel prep, and which is really not as bad as what people make it out to be. And then the day of your procedure, you go under a light twilight sedation. It may take 15 minutes. You're in and out in the morning. And to me, that's a very small price to pay. I always tell patients, don't bury your head in the sand when it comes to these things. Cancer does not differentiate. It does not discriminate. So you just don't want to miss something that is treatable, curable, and preventable. It's a very sad tragedy when a man gets diagnosed with colon cancer that could have been prevented by having a colonoscopy or Cologuard. And along the same lines, prostate cancer by having a PSA blood test by their doctor, or preventing an early heart attack by having a simple 5 to 15 minute coronary calcium scan. So in any of those conditions, the first thing here from me is getting them into the doctor, and that's why I've tried to make this office more conducive, compatible for men. For instance, as you've seen, we put ESPN on TVs, we have men's magazines, we have comfortable leather seating. We don't allow women and children. We do sometimes if wives want to come in, to discuss the care plan. But as far as we don't see women patients in this clinic. So we want men to feel comfortable, like they have a doctor that they can go and see and feel comfortable and want to go to the doctor, because the first step of getting a male healthy is to get them to the doctor. So we do believe we've created that aspect of it. And then the second thing is just like you said, I think the more time I can spend with a man, and if it's up to an hour visit, most of the visits on health, but we can talk about some sports, we can talk about some other things that make them feel comfortable and make them feel that I genuinely care, about the medical care that I want to give them. My ultimate goal is to make them live longer, healthier lives. So they're going to be around for their spouse, they're going to be around for their children, to walk their daughter down the aisle, to see, you know, their son, you know, do whatever they're going to do in life. So that's, I try to instill confidence in you know, our relationship, and then I also try to get them very motivated to look out for their health and do the goals, because again, it's a tragedy when someone becomes a statistic that could have been prevented.
Yeah, it sounds, as I follow along, if one of the best things a man can do for their own well-being is to come in and see a doctor, this kind of setting is very conducive for that. Backing up with like colon cancer, prostate cancer, strokes, heart attacks, you're going to give lifestyle advice to somebody on how to better increase their chances of never seeing those dreaded diseases. What advice would you give?
So for, you know, cancer, especially prostate and colon cancer, smoking is, as you know, at the top of the list. And then for colon cancer, certainly increasing fiber in your diet has been shown to reduce your risk of colon cancer. For heart disease and early heart attacks, obviously you want to control risk factors there, which is everything from blood pressure. You know, you want your blood pressure down to the 120 and 70 range. You want to control your cholesterol. We stratify cholesterol levels based on risk factors, but I believe that for most of my patients, I try to shoot for the bad cholesterol, or the LDL under 100, and the HDL over 40. And you can try to achieve that with diet and exercise levels, weight loss, and, you know, that kind of thing, eating healthier. But sometimes, you know, it does take a medication like a statin to try to lower the cholesterol to a preventable level. Yeah, we've all been taught this. Try to exercise 30 minutes daily or 60 minutes every other day. Try to eat as healthy as you can from all the major food groups: lean wheats, fruits, vegetables, grains. There's a Mediterranean style diet that's out there.
There's the Atkins diet for heart healthy people, or for people that have heart disease, although I believe that almost all meats are removed from. It's the Dean Ornish diet, is the diet that is used for people that have had heart disease, but it's pretty much a strictly vegetarian diet, so it doesn't appeal to everybody. To me,
fish, salmon, lean chicken, with your fruits, vegetables, and grains is the perfect style diet. Drinking a lot of water, trying to get the best sleep habits that you can, sleep hygiene, if you have sleep apnea, treating that, because that can certainly have effects on the heart. But I think obviously smoking is also involved with heart disease and all the cancers, especially the top 2 cancers in men. So trying your best to quit smoking is definitely important in preventing those diseases.
Your transformations, we try to help empower people to realize that the tomorrow doesn't have to be defined by today. The hopefulness of things like neuroplasticity, to where we can actually change at our core level. What do you say to your patients who kind of give up because of genetic factors? Oh, my family had this, so I have it now, I'm going to get it, so why does it even matter? How do you help motivate people who kind of give up because of things like genetics or diseases on the family line?
Yeah, well, just because there are, diseases genetically in your family doesn't mean that you're going to get them 100%. You are more likely to possibly get those, but when I talk about the 3 big early killers of men, prostate cancer, which is certainly is genetic. They certainly recommend checking early ages if there is a family history, especially in a primary relative like your father or your brother, of checking PSA levels, prostate cancer. And in fact, with this most recent case that I've had where a 43-year-old was diagnosed with prostate cancer, they actually are going to be genetic testing him because he has two sons that are not just now in their 20s, but they're going to do genetic testing to make sure that these kids, don't have the same fate, or at least as they move on, more in-depth testing, more in-depth counseling, even possible surgery. These kind of things can be done proactively. So anyone that says, I'm doing because I have a family history of prostate cancer, that's what I would offer there. Is they're not necessarily going to get it, but we can test for it not only from a blood standpoint, but also from a genetic standpoint. Colon cancer is also the same. The recommendation is either age 45 or 10 years before a primary relative got colon cancer. So let's say your father or mother got colon cancer at 45, then you actually are recommended to start at 35. And so again, as long as you can motivate people to go and get the colonoscopies, they can prevent these diseases, and they may not have the polyps that are going to lead to colon cancer. But if they do, they can be removed. And so, there are methods and methodologies in place to try to cure or prevent, find and cure cancer if we find it. And then with early heart attack, same thing. It certainly is genetic when it happens earlier to people. It's passed down. And so what I recommend is the coronary calciums, and if those come back positive, then we'll really get aggressive with risk factor management, with blood pressure, cholesterol, diabetes, smoking. And if it's moderate, then I'll usually refer them to a cardiologist to go ahead and get stress tested, get an echocardiogram. Also, if they need a cath. I've actually had a couple of patients that I did a coronary calcium on, the $99 test, that the next day they were in an ambulance going to a research hospital to have open heart surgery. So, and so it can be a very cost-effective and inexpensive screen that can save lives. So I don't think you're doomed based on your genetics. I just think you have to be proactive, and you have to have the motivation. And the motivation should be, I want to live, and I want to live a longer life, if not for yourself, for your family and your wife and your children and everybody else.
Surprising to me is the impact that falls have on human beings regardless of age, from young to elderly. What advice would you give to people that they can take ownership with to improve their ability to not fall, and if they're starting to lose their balance, maybe regain it quicker and recover? What are your thoughts on falls and how perhaps epidemic they actually really are?
Yeah, I think as we get older, falls are they're more prevalent because first of all, we lose some proprioception, probably due to nerve function, brain function, our ability to be aware of environment changes in movement, that kind of thing. Also, we fall because eyesight, hearing aren't as good. Also, we fall because maybe, we have joint pain, we're favoring a joint, so we reciprocate, in the opposite direction, which puts our posture, our gait off, and that can lead to falling. So, with age, inevitably, I think what's going to happen. But I do think that, walking, especially as we get older, walking and doing daily stretches or every other day stretches, because what stretches do is twofold. When you're stretching, they make you maintain balance and work on your proprioception in different directions. They also make you more nimble and flexible, so that you have less pain, and your posture and gait is probably also going to be more normal. So those are some of the bigger things that I recommend for people. For weight training, I think is still important, but a lot of times as we get older, we give up some of the weight training and the jogging and the running, and so just simple walking, 20, 30 minutes a day, or if you can't do it every day, maybe 60 minutes. And then maybe right after that, going into a 20 to 30 minute stretch program. And I actually have developed my own head to toe stretch program that I do myself and I've given to patients as well. And I think that helps, just what we're saying with falls. And then obviously, like I was saying, keep, visual checks. Anybody over the age 40 should be seeing an eye doctor probably every year. Hearing definitely, I think, influences balance. And then finally, I have referred patients to physical therapists for gait training. There are clinics in town that specialize in vestibular, which is in the brain and the ears, which is involved in balance and proprioception again. But they also work on gait training, strengthening, flexibility, all that kind of stuff. So if I have a patient and that's one of their main complaints, then I'm probably going to move through that progression of plan for them.
How do you perceive wellness, the whole person concept of a human being? How would you say your concept of that has changed throughout, from the beginning to present now in your career, of your practice?
Oh, that's a great question. I've been in practice now. I've had my MD since 1997, and then I did residency, and then so I've been in private practice now for 25 years. I think early, when you're first out of school and residency, you've learned about all these medications and things like that. So that's always staying in mind, and that's what I'm not that you push that on people, but a lot of times that's what's at the front of your mind when it comes to health and well-being, whether it be mental or physical health. But since then, over the years, especially over the last 10 to 15 years that I've really concentrated on men's health. I had a Seminole clinic in Charlotte, North Carolina, and then since I've been back to Parkersburg, even when I was corporate, I still focused, mainly on men. But now that I own, this is our 4th year of having Men's Health at Parkersburg opened. I'm much more now into promoting, natural, healthy lifestyles, holistic approach